For weeks now, the Kenya Medical Supply Authority, KEMSA, has been wading in muddied waters, soiled by the allegations of graft and profiting off the misfortune of Kenyans amid the COVID-19 pandemic. But it's not the first time KEMSA has been caught on the wrong. NTV's Zainab Ismail revisits the agency's dark past.
As investigations into the irregular procurement of COVID-19 equipment at the Kenya Medical Supplies Authority intensifies, more calls for accountability still echo out.
It is our position as a party that it would have been best for the procurement of all COVID-related items by KEMSA be subjected to an audit, and that from that audit we can see recommendations for investigation and prosecution for certain individuals.
KEMSA's mandate lies in sourcing medical-related supplies from manufacturers and global suppliers to ensure an efficient public health supply chain. But far from that, it has been on the spot more than a few times over corruption-related scandals. By the time KEMSA was fully operational in 2005, it was already tainted by allegations of graft and government interference. In 2013, it was transformed from a government agency to an authority, thus making it independent from government. But nothing much changed. In 2018, KEMSA was battling allegations that its employees had been colluding with rogue traders to supply expired drugs to the market. The Auditor General, in a report tabled in the National Assembly, said KEMSA could not explain why it stocked expired drugs, yet hospitals countrywide were still facing shortages.
Nusu ya hizi pesa officers wa KEMSA na wale wakora nilitoa kwa ofisi, hizo dawa zilifika zikadivatiwa zikauzwa.
A report by the Auditor General for the 2017-2018 financial year and tabled in Parliament last year flagged some 1.6 million shillings paid out to 4 board members as sitting and lunch allowances during the year under review, without documents to support the payout, raising doubts on its validity. The agency has asked the government for a 5 billion shillings bailout to avoid stalling its operations, claiming it was broke, even though it had emerged that the authority failed to account for 17 billion allocated to it for the last financial year. 2 major foreign donors at the Ministry of Health have also threatened to withdraw funding due to graft. And the KEMSA board had on Friday last week sent home its chief executive, Dr. Jonah Manjari, alongside directors Eliud Muridhi and Charles Juma. Zainab Ismail, NTV.